My name is Nicole Debris. I am a physical therapist with a board specialty certification in women's and men's pelvic floor physical therapy. The specialty of pelvic floor physical therapy focuses on the pelvic floor muscles, which are the muscles that sit right in the seat of your pants. It also encompasses kind of the whole core system. So this includes the muscles in the seat of your pants all the way up to the diaphragm, which is right at the bottom of your rib cage. The muscles in the pelvic floor work for many different functions. The pelvic floor muscles work for urinary function, bowel function, sexual function, and they also work for the support of our internal organs and the support of our hips and our back. So common diagnoses that a pelvic floor physical therapist will treat are things like urinary dysfunction, which can include urinary incontinence, urinary urgency or urinary frequency, as well as urinary retention. Pelvic floor physical therapists also see patients for bowel dysfunction, which could include things like fecal incontinence or constipation. We also see a lot of pregnancy and postpartum, just because the process of carrying a baby puts a lot of stress on the pelvic floor muscles. It puts a lot of stress on that core system. Oftentimes those muscles need prehabbed during pregnancy and then rehabbed after pregnancy. Pelvic floor physical therapists also see people for sexual dysfunction, like pain with intercourse or pain with some sort of like vaginal penetration. And then we also see all sorts of different diagnoses of inflammatory conditions around the pelvis. So this can be things like endometriosis that might be causing pain, or something like interstitial cystitis, which is a bladder condition that can cause pain. Pelvic floor physical therapists will also look at the hips and the back and the diaphragm and your whole body and kind of how it's working together, because it's not always just the pelvic floor muscles that are causing the issue. If you're interested in learning more about pelvic floor physical therapy, you can visit us online at our website or call any of our clinics. If you are hesitant about coming in and you want to speak with a pelvic floor provider prior to coming, you can always call and we can do a little assessment over the phone just so we can get a good idea if you would be a good candidate.